All right, get ready to dive deep today because we're tackling non-Hodgkin lymphoma.
NHL.
NHL, that's right. And we're not just going to scratch the surface.
Right.
We are going full-on investigative mode
Absolutely.
to really figure out what increases your risk for this really complex group of cancers.
Yeah. It's a fascinating area, and I think some of the things we'll uncover might even surprise you.
Okay, so before we get ahead of ourselves, let's just start with the basics.
Yeah.
When we say lymphoma, what are we even talking about?
So think about your immune system, right? It's like this incredibly well-trained army constantly patrolling your body, fending off any invaders. And you've got these lymphocytes. They're kind of like the elite soldiers in this army.
Okay.
They're a type of white blood cell that's absolutely crucial for fighting off infections and diseases.
Right.
But sometimes these lymphocytes, they can go rogue.
Oh, yeah.
They become cancerous and they start multiplying uncontrollably.
Uh-oh.
That's when we're talking about lymphoma.
Okay, so it's like a mutiny within the ranks.
Yeah, exactly. A perfect analogy.
Wow. Now, I noticed when I was looking through all the research for this that weakened immunity,
Yes.
that seems to be a big red flag.
Right. It's a major theme that emerges again and again. And you're absolutely right. It's like if your army's already depleted, it's so much easier for the enemy to take over.
Right. And it makes sense that conditions like HIV/AIDS, where the immune system is really compromised,
Severely compromised.
it would make someone more vulnerable.
Yeah.
But you know what really surprised me?
What's that?
Was the connection to autoimmune diseases.
Oh, absolutely.
It's like the immune system is attacking itself.
Right.
That it can't keep up with other threats.
Yeah. It's almost like this friendly fire situation where the immune system is so busy fighting itself that it's not as effective at recognizing and eliminating those abnormal lymphocytes.
And this is especially relevant for women, right?
It really is. Conditions like Hashimoto's thyroiditis, Graves' disease, lupus,
Right.
these are all much more common in women.
Yeah, and it's actually a huge disparity.
It is.
Something like 80% of all patients with autoimmune diseases are women.
That's a staggering statistic, isn't it? 80%. It really makes you wonder if there's something unique about the female immune system that makes it more susceptible to these kinds of issues.
Yeah, it really does. So are we talking too much of a good thing here?
Right.
Like maybe women's immune systems are just super powered.
Potentially. One theory is that it could have to do with the X chromosome.
Okay.
Women have two X chromosomes, right? Whereas men have an X and a Y. And the X chromosome actually carries a lot of genes that are involved in immune system development.
Interesting.
So having two X chromosomes might increase the risk of certain autoimmune disorders.
So maybe it's like this double dose of immune response genes that can backfire sometimes.
It's a possibility. It's definitely an area where more research is needed, but it's a fascinating piece of the puzzle.
It really is. Okay, so we've got weakened immunity, and we've got this connection to autoimmune diseases.
Yeah.
What other risk factors are we finding in this research?
Well, this one might surprise you, but a lot of the research points to the role of certain infections.
Okay, yeah, see, I knew that some infections could lead to cancer.
Right.
Like I always think about HPV and cervical cancer.
Of course. Classic example.
But I honestly had no idea about the link to lymphoma.
Yeah, well, it turns out that several specific viruses and bacteria have been linked to an increased risk of developing certain types of NHL.
So spill the tea.
Yeah.
What kind of infections are we talking about?
Well, one of the big ones is the Epstein-Barr virus,
Okay.
which is what causes mononucleosis, the kissing disease.
Yeah.
And studies have shown a connection between Epstein-Barr and an increased risk of certain NHL subtypes.
So even something as common as mono can have these long-term consequences.
It can. It's a reminder that even seemingly harmless infections can sometimes have lasting impacts on our health.
That's a little scary.
And then you've got Helicobacter pylori,
Helicobacter pylori.
which is the bacteria that causes those pesky stomach ulcers.
No way. The stomach ulcer bug.
The one and only.
What? That can be linked to lymphoma.
It's been associated with a higher risk of certain types of NHL. And what's interesting here is that H. pylori actually causes chronic inflammation in the lining of your stomach.
Okay.
And that chronic inflammation, it basically creates an environment where cancer cells can more easily develop and thrive.
So it's not H. pylori itself directly causing the lymphoma.
Right.
But it's creating this environment where it can happen.
Precisely. It's like setting the stage for lymphoma to potentially develop.
I never would have connected stomach ulcers and lymphoma.
It's not the most intuitive link, is it? But it just goes to show how interconnected our bodies are and how seemingly unrelated things can actually influence each other.
Right. And of course, we can't forget about hepatitis C,
Oh, of course.
which we know can lead to liver cancer.
Right.
But it's also been linked to some NHL subtypes.
Exactly. It's another example of how certain infections can increase the risk of developing certain types of lymphoma.
So it sounds like it's not just about one isolated thing. It's this combination of weakened immunity and these specific infections. It really paints a picture of how someone's risk for NHL can go up.
Absolutely. It's like layering these different risk factors on top of each other.
Okay, so we've got the weakened immunity, we've got the infections. What other puzzle pieces are we uncovering here?
Well, there's another broad category of risk factors that are related to lifestyle, demographics, and environmental exposures.
Okay, let's unpack that. What are we talking about here?
So we're talking about things like age, for example. Your risk of developing NHL, unfortunately, does tend to increase as you get older.
Okay, that makes sense.
We also see links to lifestyle factors like obesity and smoking, which, as we know, are linked to all sorts of health problems.
Right.
But they've also been specifically associated with a higher risk of NHL.
Okay.
And even high consumption of red meat has shown up in some studies as a potential risk factor.
Red meat. Really? I'm kind of noticing a theme here. infections, smoking, obesity, these all contribute to chronic inflammation in the body, right?
You're absolutely right. Chronic inflammation is like this simmering fire that can damage cells and potentially create an environment where cancer can take hold.
So maybe that's the common thread here.
It very well could be.
These different risk factors, in their own ways, are all contributing to this environment of inflammation. And that's what's setting the stage for lymphoma to develop.
It's a very insightful observation, and it's likely a key part of the puzzle. When we talk about NHL risk, we're not just talking about isolated factors, we're talking about how they all interact and contribute to an overall picture of increased susceptibility.
So it's not a simple cause and effect.
No, not at all.
Yeah.
It's more like this complex web of interactions.
Yeah. I was reading some research about canine lymphoma,
Oh, interesting.
and they're using these acute phase protein levels in dogs to assess lymphoma risk. And it made me wonder, is there anything similar for humans?
It's a great question. And while blood tests are absolutely crucial for diagnosing NHL, they're not typically used in the same way to predict risk in humans. In humans, we tend to rely more on a combination of factors like family history, lifestyle choices, and exposure to those risk factors that we've been talking about to kind of assess overall risk.
So it's not just like one blood test. You can just go get.
Not quite yet.
Yeah.
Although, who knows what the future holds.
Right. That's good to know. There was one more thing I wanted to ask you about, and this one really threw me for a loop.
Oh, I'm intrigued. Lay it on me.
So I was reading this research about reproductive factors, and it suggests that full-term pregnancy might actually be linked to a lower risk of some NHL subtypes.
You read that right. It's a fascinating finding, isn't it? And one that researchers are still trying to fully understand.
Yeah, because everything else we've talked about so far has been about increased risk.
Exactly. So to see something that's potentially protective, it really makes you stop and think.
Yeah. So do we know why pregnancy might have this effect?
Well, one of the leading theories revolves around progesterone,
Okay.
which, as you know, is a hormone that plays a crucial role during pregnancy.
Right.
But it also has these complex effects on the immune system.
Interesting.
And some researchers believe that this surge in progesterone levels during pregnancy could somehow recalibrate the immune system in a way that makes it less susceptible to developing certain types of lymphoma later in life.
So it's almost like pregnancy is giving the immune system a tune-up.
In a way, yes. It's a fascinating idea, isn't it? And it highlights just how intricate the relationship between hormones, immunity, and cancer development really is.
That's really mind-blowing.
Absolutely.
This deep dive is already full of twists and turns.
Yeah.
I can't wait to see what else we uncover as we go even deeper.
Me too. It's just the beginning.
Stay tuned for part 2, where we'll delve even further into this fascinating topic.
It's kind of strange, though, how pregnancy might offer some protection,
Yeah.
but other reproductive factors don't really seem to have a clear impact, you know?
Oh, really? Like what kind of factors?
Well, they've looked at things like when a woman first gets her period,
Okay.
or if they breastfed or even used oral contraceptives.
Okay.
And the research just hasn't shown any consistent links to NHL risk.
Huh. So it seems like full-term pregnancy is really the key player here.
Yeah, it seems that way.
Yeah.
But it really makes you wonder, like, why?
Right. What is it about pregnancy that
Exactly.
could have this protective effect?
Well, like we were talking about earlier, it could be that progesterone surge.
Right.
Progesterone's a pretty powerful hormone.
Yeah.
And we're just starting to understand how it interacts with the immune system. So it's possible that that big hormonal shift during pregnancy kind of like recalibrates the immune system and makes it less vulnerable to certain types of lymphoma later on.
Wow. So it's like pregnancy is giving the immune system a tune-up.
Yeah, something like that. It's definitely a fascinating area for more research.
It really is. But I guess even with all these risk factors we've talked about,
Right.
it's not a guarantee that someone's going to develop NHL.
Exactly. It's important to remember that these are just risk factors. They're not guarantees. Just because you have one or even a few of these risk factors, it doesn't mean you're definitely going to get NHL.
Okay.
And on the flip side, someone with no known risk factors could still be diagnosed.
So we're talking probabilities here, not certainty.
Exactly. It's like you're rolling the dice.
Okay.
And certain factors might load the dice in a certain direction,
Yeah.
but they don't determine the outcome with absolute certainty.
Okay, that's a really good way to put it.
Right.
I like that a lot.
Yeah.
It reminds me that even with all the research and everything we know,
Yeah.
our bodies are still incredibly complex.
They are.
And there's still a lot we don't understand about cancer development.
Absolutely. There could be genetic factors, environmental factors that we haven't even identified yet that play a role.
That's true. So, okay, we've talked about risk factors a lot. What about prevention? Is there anything people can do to lower their risk of developing NHL?
Well, unfortunately, there's no magic bullet, no guaranteed way to prevent it, but maintaining a healthy lifestyle,
Oh, yeah.
that can definitely help reduce your overall risk of cancer,
Okay.
including lymphoma.
So we're talking like the usual advice.
Pretty much.
Eat healthy, exercise. Don't smoke.
Yep. It might sound cliche,
Yeah.
but those things really do make a difference. A balanced diet, plenty of fruits and veggies, whole grains,
Right.
regular physical activity, and of course, avoiding tobacco smoke.
Right.
Those can go a long way in supporting your overall health and reducing your risk of chronic diseases,
Yeah.
including cancer.
It's like we're building up our body's defenses.
Exactly. You're strengthening that fortress.
Yeah. And of course, managing any other health condition.
Absolutely.
Like those autoimmune diseases we were talking about.
If you have any underlying health conditions,
Right.
It's so important to work closely with your doctor to manage those and address any concerns you have about your immune system.
It's all about being proactive.
It is.
Taking control of our health.
Absolutely. And that's what's so great about having these deep dive conversations.
I know.
We're learning about these risk factors and we're empowering ourselves with knowledge.
Yeah.